So when you're checking for diastasis recti, you can check at 3 different spots. At the belly button, about halfway between the belly button and the sternum, and then halfway between the belly button and the pubic bone. So what you're going to do, starting at the belly button, you're going to take your fingers right in that midline, and then you're going to lift your head up. When you lift up, you want to feel for how many fingers you can get into that gap between those 2 six-pack muscles. So you're going to check here, relax. You're going to come to that top spot again. So you're going to lift up, feel for how many fingers you can get into that separation, and then come on back down. And then you're going to go to that lowest spot, again, lift up, feel for how many fingers you can get into that separation. So now say you feel like you can get about, 2 to 3 fingers in this spot here in the middle. So now before you lift up, I want you to take a nice big inhale. And then as you exhale, you're going to tighten these deep core muscles right inside those hip bones. So you're going to exhale and tighten. Then holding that squeeze, you're going to lift your head up again and feel for any difference in that separation, whether it's the width or the depth. So it's good if you can do this while engaging those deep core muscles and then feeling less depth. That's a good sign that your diastasis recti can be improved, with some core strengthening exercises. So again, you're going to take a nice big inhale, exhale and tighten, and then lift up. Okay. So this is one of the starting points with core exercises that I give all my patients. So first, just learning how to engage your deep core laying down. So take a nice big inhale. As you exhale, you want to feel these muscles right here, right inside those hip bones, puff up. So that's your starting point. If that's all you can do right now, that's okay. So you're doing that, say maybe about, 2 rounds of 10 squeezes here. Learning how to turn those core muscles on. Once you get that down, that's when we can progress it. So now a progression of this would be, inhale, engage those core muscles, and then you're just lifting 1 foot up at a time while still breathing, that's important, and still keeping these muscles right here turned on. So if you're doing this and you notice increased doming or pressure through the middle, then that's a sign that this exercise may be too advanced for you, and that's okay. Just go back to the previous step and work on, more reps or more sets at that basic level before going to the march.